Hi everyone, I am Kirtana, your ICU nurse. Today let's quickly learn about the neurological assessment. A neurological assessment in the evaluations of a patient nervous system function including brain, spinal cord and the periphery nerves. So for what purpose we are assessing the neurological assessment? To assess the patient's level of consciousness and orientation, and to identify the neurological deteriorations, and to monitor response to the treatments if the patient is having any head injury or stroke, and to detect early sign of increased intracranial pressure. Why neurological assessment is important in ICU setting? Because if the patient is having any high risk of neurological complications such as brain injury, stroke, seizure or decreased level of consciousness, so we can detect earlier and save lives. In neurological assessment, we have 5 components. A level of consciousness. For level of consciousness, we are using the tool Glasgow Coma Scale, and orientation, pupillary reaction, posture and reflex. In Glasgow Coma Scale, we have 3 parameters. One is eye response, verbal response and motor response. In eye response, we have a 4 score like a spontaneous, to sound, to pain and none. In verbal, we have 5 scores: orientation, confused and inappropriate words, inappropriate sounds and none. In motor, we have 6 scores like obey commands, localizing, normal flexion, abnormal flexion, extension and none. So the total score is 15 if the patient is having a 13 to 15 a mild, and 9 to 12 moderate and 3 to 8 is severe. So in ICU setting, if we are monitoring the GCS, so in shortly we will be mentioning like EVM. Orientation. In orientation, we need to ask the question to check if the patient is oriented to time, place and person. So how we need to ask the questions to the patients, like time, can you please tell me today's date or today time, and place, and where are you right now, and for person, what is your name and who am I, like that we need to ask the questions like time, place and person, whether the patient is oriented or not. Posture. In posture, we have two. One is decorticate and decerebrate. The first is decorticate. It is a flexor response, and how it look like the arms are flexed towards the chest and legs extended and internally rotated, feet plantar flexed. It mainly indicates damage to the cerebral cortex above the brainstem. So always remember cortex C. It is means arms to the core, chest. Cerebrate. It look like a wrist pronated, palms facing out, legs extended and stiff, and damage to the brainstem more than decorticate. Always remember decerebrate is extension. Pupillary response. In pupillary response, we have the assessment like equal, round, reactive to light, accommodation. To check whether the patient's size observes both pupil in normal to the light, and the shape, it is round and regular, and equally it is reacting to the light. And as the patient look at the distance object and at near one, pupil should constrict when focusing on the near objects. So these 5 are the pupillary response we need to assess. Deep tendon reflexes. Deep tendon reflexes to check the reflexes like biceps, triceps and knee and ankle. The normal graded as 2+. If the patient is having abnormal or it denotes hyperflexia, or absent reflex can indicate the neurological dysfunction. Do follow, like, share and subscribe. Thank you. Bye bye.